Okay, we're recording. So we'll review the 3 chapters, then we'll review the study guide. And then if we have time, we'll go through some of the NCLEX practice questions. You also should have received an announcement yesterday, I believe, with the review sessions coming up. Okay, everybody, there's 4 review sessions coming up. Everybody know what I'm talking about? Okay, so 2 Friday, 1 Saturday, 1 Sunday. I realize people work on the weekend. I realize some people have clinical on Fridays. They're out there to help you. Okay, so I can't force you to attend. I certainly encourage you to attend. I believe that when you attend live, you have a better chance, or you do better on the exam than watching recordings. Not to say recordings aren't helpful. Sometimes that's all you can do. So you'll have the opportunity to attend 4 live sessions. And then once we do our sessions, we all send our recordings to each other so that we can post in the announcement. So you'll also have all 4 recordings. Okay. And of course, the content of the review sessions should be similar, but the way it's presented is different. And so you can pick and choose what you want to do, but we try to make it available on the weekends as well. I'm doing one Sunday. Mine is Sunday. So any thoughts on that? You guys think you're going to try and get to one? What are you guys thinking? I would highly encourage you to, highly. And I know from my class from yesterday that this week is med-surg exam, correct? This week is, for those of you that have med-surg, this week is a med-surg exam. Next week is community all by itself. And then the following week is peds. Okay, so there's no conflict with your community exam for next week. Okay, so hopefully you'll be able to spend the time that you feel like you need. I know with exam 1, it was crammed with the med-surg exam. I'm well aware of that. I heard that over and over again in my review sessions. So hopefully you can get through your med-surg exam this week and try and attend some community review sessions and be fully prepared for next week. Again, I will tell you that the study guide is an excellent representation of the information or the exam. Okay, so what I heard from a lot of students, I think, I heard from a lot of students that they were going back to the book and reading chapters and redoing the study guide. A few students said they redid the whole study guide into their format, and what turned out to be a 4-page study guide, they made into an 8-page study guide. And so the study guide, I think, should be fine as is. We'll review it in the next hour, but don't make it any more difficult, right? What's in the study guide is what you need to know for the exam. Okay, I don't know any other way to say it. And when we go through the study guide, we'll try and think of what kinds of questions might be asked. So we'll do that. We'll do that exercise as well. Okay. Anybody have any questions? There are, I think, 2 groups in this class that I haven't heard from as far as what your infectious disease is going to be for the group project. So if you're in one of those groups, would you get that information to me, please? What else? What questions you guys have before we get started? Nothing?
Professor Marble.
Mm-hmm.
I tried to get on the NCLEX, the 50 questions.
Yeah.
And those 2 things that you picked were not in there. Does anybody else have issues?
Yeah, is anybody having, well, I've had people already turn in the assignment.
No, they're in there. Dina, is that you?
Yes, it is.
Okay, I can walk you through it later. It's in there.
Yeah,
Okay. Thank
okay,
you, Teresa.
You're
okay.
welcome.
Thanks, Teresa. Okay. Okay, so I won't reply to your message. Teresa's going to help you walk through it. I figured they were in there because people have already been doing the assignment. Do you guys, any more questions about anything?
What did you say about the group project? I'm sorry.
I said there's a couple of groups that I have not heard from as far as what you're doing for your infectious disease. So
Are they
if
the
you,
same group that we had before?
pardon me?
Or are they different groups, or are they the same groups
No,
that we?
same.
Okay.
And I just need one person to let me know. Most of you have, but there's one, if not two groups in this class that I haven't heard from yet. I just want to make sure we're not, three groups aren't doing the same thing. Because it does require some peer responses, and I want you guys to be able to learn about different infectious diseases. Okay. All right, what else? Okay. You probably will be hearing from your deans as well as a reminder about the review sessions, because in the at-risk meetings I've been at yesterday and today, I have told the deans that I will send out a copy of the 4 review sessions. And if we could encourage the deans to encourage you guys to go to the session. So don't be surprised if you hear from your deans, okay? Nobody's in trouble at all. It's just another voice, another bug in your ear, encouraging you to go to these review sessions. Okay. All right. All right, let's get going. Okay. Has anybody taken a look at, anybody know what we're covering today? I know the topics we're covering today.
Occupational health,
Yep. Chapter 32. Yep. What else are we covering?
environmental,
Yep. Chapter 6. What else?
epidemiology or something.
Epidemiology, chapter 9. Okay, let's start with chapter 6. I'm going to do a little bit different today. We're going to review the PowerPoint, the outline, and then we're going to go into the book, because I want to highlight some things in the book that are essential knowledge, okay, that are part of learning of the concept. Okay, so when you guys think of environmental health, what do you think about? What's environmental health? Think about it. What's environmental health?
Pollution.
Exactly.
Like the environment.
Yep.
Like hazard and like not, I guess, natural disasters or some stuff like that.
Mhm. The things we're concerned about with environmental risks, the 4 major things we're concerned about are the air, the water, the food, and the air, water, food, and soil, I believe. We'll get to that in a minute. So
Okay.
environmental health. Healthy environment is essential for optimal health, right? We often take the environment for granted and may fail to see hazards in front of us. We, as a population, are exposed to chemical, biological, radiological exposures that can affect our health in the air we breathe, the water we drink, and the food we eat. Okay. I mean, how many of you, I do, how many of you guys take for granted in your own community that the water's healthy? Water's, right? It's not polluted, that the pollution level is at a manageable level, right? When I do this chapter, I always think about the movie Erin Brockovich. Anybody ever see that movie?
Which one?
Erin Brockovich.
Oh no, I haven't seen it.
Anybody seen Erin Brockovich?
I did.
What's it about?
Is it about the water?
The water contamination from a power plant that get into the water supply for a community in, I think, rural Texas. A lot of people died of cancers and
Oh,
this
so
is
like Detroit,
what? Yeah,
like
yeah.
Michigan.
The water, yep, exactly. Again, I want you to take a look at the objectives. Okay, right? We need to be able to answer these. And if you all haven't done a lot of preparation work for this week's lecture, then you're going to have to go back and reread some things. So you need to go back and reread the objectives. Okay. We're going to cover most of it, but you need to be able to articulate these objectives. The expectation is that once you've reviewed this chapter, you can answer these questions. So again, we're going to go through the PowerPoint quickly and then go to the book. What are some different health sciences that fall within environmental health sciences? We have toxicology, we have epidemiology, we have multidisciplinary approaches. We'll go through that in the book. Climate change, environmental issue? Yes or no? It's one of the biggest environmental issues we have, correct?
Yeah.
Right.
Yes, it is.
Yeah. Okay. Climate change around the world has led to global warming. Implications of climate change, what are they on public health? Most vulnerable populations, what do they include? Children, the elderly, sick, those especially with compromised immune systems, chronic diseases, poor.
People with respiratory problems.
Exactly, exactly. Okay, when we're doing an environmental health assessment, this is if you're in community nursing, you may be doing an individual assessment, you may be doing a family assessment, you're also going to be doing an environmental assessment, right? With an environmental assessment, we look at air, water, land, and food. Okay, we're trying to do an assessment of exposures to chemical, biological, or radiological agents. We'll go through the I Prepare mnemonic of how to do an environmental assessment. It's in the book. Environmental assessments are also done through windshield surveys, environmental databases that are kept, environmental health assessment forms, and unintended environmental exposures. Hang on one second. Isabel, that just came in. I think I have one of Dr. Lundy's students, so just bear with me. Isabel, are you there? I just let you in. Heather. Okay, sorry for the interruption. Okay. Okay, continuing on with part of our environmental assessment is the right to know laws. And we'll go through those in the book. Risk assessments. What's a point source and a non-point source? Assessing the risk in children and pregnant women with environmental risks. Right? Sorry. How do we reduce environmental health risks? Well, we want to apply the basic principles of disease prevention. How do we do risk communication to the community if you're the community nurse What are the ethics with environmental health risks? Think back to that movie, the intentional water contamination that damaged a whole community. And what are the governmental environmental protection acts, laws, guidelines? And then what's our role as nurses? As far as advocacy, we have the responsibility to be informed consumers and to be advocates for citizens in our community regarding environmental health issues. You can read through, we don't really need to go through 11 and 12. We don't really need to go through 11, 12, and 13, but number 14, or slide 14, what are some of the roles that nurses have in environmental health? Well, we have to be able to do our ADPI, okay, which starts with assessment. So you need to be able to take your ADPI and apply it to environmental health. Okay, and there's a section in the book, I'll show you where that is. It's really good, actually. But what are our roles? Assessment, referral, community involvement, public participation. Think of yourself as the environmental nurse. You're going to be involved in communication of risks. You'll be involved with epidemiological investigations and maybe policy development. Okay, so that's our outline. I want to go into the book. Okay, environmental health starts on page 84. Okay, so there's things we need to know in here, okay, that help us answer and articulate the objectives. Okay, when I think of environmental health and the risks associated, I think of maybe the rural community as different risks than the cities, right? Maybe you live near a highway with a lot of pollution. Maybe you live in an industrial area. Maybe you live near a waste site. Lots and lots of different environmental risks. They're everywhere. Everywhere. Okay, so we just went through this, our chapter outline in the PowerPoint. Okay, here's our objectives. That was slide 2 in your PowerPoint. Key words. And you know about, I don't know if you guys have tried this, but for example, we need to know, what an epidemiological triangle is. So if you click on the word, it takes you right to the section in the chapter where it is. Do you guys know that? Yes or no?
No, but now I do.
Okay. Okay. So I'm going to skip through this chapter and we're going to stop at some areas that we need to know. Okay. Let's see. Okay, the first thing we want to tackle is the Healthy People 2020. I can tell you from the last exam, there were several people who got Healthy People 2020 questions wrong. Okay, so I'm going to repeat what my mantra is about healthy people. If you're asked a question about what are the healthy people goals and objectives for a particular topic, this is why I ask you to review the Healthy People 2020 box that has a big heart in every chapter. Okay, so for example, there were a couple of questions in the last exam that all the answers seemed good, right? They all seem, oh, great idea, that's a good goal, that's a good objective. But there was only one answer that came from Healthy People 2020. Okay, so don't get tripped up on the questions that, if it's a Healthy People 2020 question, they're asking specifically about Healthy People 2020 objectives. And of course, Healthy People 2020 objectives are different in every chapter because they're geared towards different topics. So in this particular chapter, chapter 6, they're related to environmental health. Okay, so you have 6. Write them down or put them on a card, but you need to know about these. And it could be a select all that apply question, or it could be pick what the objective is that's related to Healthy People 2020 and environmental health. Pick one answer or select all that applies. So please know this. Okay. The other thing that you guys as a whole did really, really well on with the first exam is the prevention questions. There were 4 or 5, maybe 5 or 6 prevention questions. You know, what's an example, or pick out what a primary prevention is, secondary, tertiary. You guys did really, really well overall as a group on those. So that's great. And each chapter, like here, each chapter has a Healthy People 2020 box, and each chapter has a prevention box, levels of prevention box. The more experience you can get with those levels of prevention in all the different chapters, the better you're going to be at identifying them, because it's the prevention levels are very HESI, very NCLEX focused. All right. So for example, we're in environmental health in this chapter. So we'll get to it, but you should be able to identify what is a primary intervention for environmental health, what's a secondary, and what's a tertiary. Okay, we'll get to that. Okay. All you really need to know about environmental health sciences are what are a few of the environmental health sciences. What's toxicology? What is a brief description of what is the definition of toxicology? Basic science that studies the health effects associated with chemical exposures. That's all you need to know. We don't need to know the whole paragraph, whole half a page. We just need to know what is toxicology study? It studies chemical exposures. Okay, what is we're going to get to epidemiology in the next chapter, but it comes up here as well. What is epidemiology study? Okay. Whereas toxicology is the science that studies poisonous effects of chemicals, epidemiology is the science that helps us understand the strength of the association between the exposures and the health effects. Right. So the disease aspect of it. Right. We're going to chapter 9. Our next chapter describes epidemiology in detail. Okay. So for example, here's a book example. Epidemiology studies have helped explain the association between, say, learning disabilities and exposure to lead-based paint. Right, as well as maybe increased diagnoses of asthma in communities that have a lot of air pollution. Okay, we're going to talk about the epidemiological triangle in chapter 9, which is the agent, host, and environment. So we're going to skip through that now, or skip over that now. So, and then the third health science within environmental health, it's called multidisciplinary approaches. Okay, simply, in addition to toxicology and epidemiology, there are some earth sciences that help explain how pollutants travel in the air, water, and soil. Okay, that's simply what we need to know about a multidisciplinary approach. Okay, what I really want you to understand is the first two, or at least be able to define it. Simply define. Epidemiology is the study of, and toxicology is the study of. Okay. We know about climate change, right? According to the World Health Organization, climate change is significant and emerging threat to public health, right? And changes the way we need to look at protecting vulnerable populations. Okay, that's all I'm going to say about climate change for right here. Okay, so the other thing I want you to know is right here. There's 2 current category rules for nurses: mitigation and response. Okay, So I need you to understand the difference between mitigation and response. Okay? So I need you to read this paragraph, and I need you to read this paragraph. I'm not going to read it for you guys because I'm just not. You guys need to do some of the legwork here. But here's where it is, page 89, the difference between mitigation and response. Okay? How do we do an environmental health assessment? Okay, environmental health risk assessments can be done in various ways, right? We're going to typically want to assess the environment by air, water, soil, or food, right? So those are 4 environmental factors that we could be assessing, or we could assess by setting, urban, rural, suburban. And then the third type we could assess by is location. Are we doing a home environmental assessment, a school environmental assessment, workplace, rec center? And think about it. Think about all the environmental risk exposures in all these 3 areas: air, water, soil, food, rural, urban, city, home, school, workplace, community. I mean, think of all the potential environmental risks with all that. Right? Okay, here's an excellent box of how to transform your ADPI from the acute care setting of doing an assessment of, say, a pediatric patient into doing an assessment in the community with regards to environmental health. So please review this box, page 91. It takes your ADPI and looks at it through the lens of community, environmental health. All right. For example, assessment includes inventories and history questions that cover environmental issues. Okay, planning, look at community policy and laws as methods to facilitate care needs. Okay. This is excellent. This is an excellent exercise, activity to read through. Because for this class, we are applying the nursing process to community health, public health. And so this is a good tool right here. Here's our I prepare mnemonic that was in our outline, PowerPoint. Okay, how do you do an exposure history? Right, so in exposure history, we may want to identify current and past exposures. Okay, obviously our long-term goal is to reduce adverse health effects from exposures. So this mnemonic gives several areas of which we're going to ask questions about. Okay, so you can read through it. You really just need to know what each of the letters stand for. Right? I is investigate potential exposures. P, what's your present work? Oops, sorry. P is your present work. R, where do you live? Some questions about where you live. E, what are the environmental concerns? P, what's your past work? A, what do you like to do? Okay, so just know that mnemonic is available to be able to identify and do an assessment of current and past exposures. And then this next section goes through what kinds of with the air, the water, the soil, and the food. It just explains those, what could potentially happen with air pollution. Okay, the one thing we need to know about air, the air section, is what is the difference between a point source and a non-point source. Okay, so air pollution is divided into two major categories. One is a point source and one is a non-point source. A point source is often a fixed site, which are individual identifiable sites such as smokestacks. Where would you find a smokestack? So they're stationary fixed sites. So you'll find them industrial sites, right? Where else might you find smokestacks? Anybody? Hello?
Rural or industrial settings.
Yep. Everybody knows what a smokestack is, right?
Yes.
Okay. And then we have non-point sources, which are non-fixed sites, such as vehicles, cars, trucks, buses. Okay. So we know that motor vehicles are the greatest single source of air pollution, right? And then they talk about indoor air quality, such as workplace, schools, homes, right? With the alarming incidents, increase in asthma, especially in children, there's great concern for indoor air quality. They go through, let's see, and then they talk about the water. You know, what possibly could go wrong with contaminated water, right? Discharges into the water bodies from industries, from a wastewater treatment system can contribute to the degradation of water quality, right? Water quality is also affected by the non-point sources of pollution, stormwater runoffs, paved roads, parking lots, erosion. And then land. Past and present use of land can affect the community's health, right? I mean, they have to determine whether they can build a new subdevelopment on top of an existing, say, landfill. Okay, so you can read about these four. And then food. What about if your food's not prepared? Foodborne illnesses have increased dramatically in recent years, especially chicken, eggs, spinach. Those are the main ones. But how do you know? You know, you go into a restaurant and you just make the assumption that everybody's practicing good preparation, washing their hands, washing the food, cooking the food at the right temperature, and doing all the things to prevent a foodborne illness. Okay, and the local health departments oversee that, right? But there's environmental health risks when you don't follow the guidelines. Okay, and then the right to know. Really simply what you need to know is that we do have the right to know. The public community has the right to know, right? Several environmental statutes give the public the right to know about hazardous chemicals in the environment. Okay, the one thing that I always point out to my students, because it's pretty interesting, is the EPA, who knows what the EPA is? What's the EPA? The Environmental
Protection Agency.
Yep, it's a federal agency that oversees environmental health. And one thing they have on their website, it's called EnviroFacts, right? Where you can go into this website and you can put in your zip code. Okay, and it's going to give you data on sources of environmental exposures by typing in your zip code. So if your zip code's near a highway, right, it's going to talk about air pollution. If your zip code's near water, it may talk about that. So have a look. Okay, risk assessment. How do we do a risk assessment? Okay, so currently the EPA, which is the big federal agency that oversees environmental health, uses risk assessment when it develops health-based standards. And so what is a risk assessment? Right? A risk assessment is a process they go through to determine the probability of a health threat associated with exposure. Okay, so if there has been contaminated water, right, the EPA or that agency will do a risk assessment. Is what is the probability of a health threat associated with the exposure? Is it low? Is it high? Okay, and that's where toxicology comes in. That's where epidemiology comes in. Okay. And this is interesting. Well, let's read this first. Assessing environmental health risks in children. This section talks about fetal development. There are periods of heightened sensitivity to the effects of toxic chemicals. During such times in fetal development, even extraordinary small exposures can prevent or change the process that may permanently affect normal development. Right? It's extremely important right here. It's extremely important to safeguard women's environments when they're pregnant. Okay, so children and pregnant moms have an increased risk for environmental and have potential increased environmental health risks. Table 6.1 is for your viewing. Sorry. So here's some environmental agents, and here's some potential adverse reproductive outcomes. So you think what's common, maybe lead. Okay, and known suspected effects. So the prenatal period, fetal development is extremely important. That you're ongoingly assessing environmental risks at every single prenatal visit. Okay. Okay, here's our levels of prevention, page 97. They're related to the environment. And one of the most common environmental risks is lead exposure. So let's address that. So what would be a primary prevention for lead exposure? Well, what's primary?
The paint, to change the paint,
Yeah, but what is primary? What are we trying to do with primary?
to prevent.
Prevention, education. So we are trying to educate to use only non-lead based paint. Right? With secondary, what's secondary? Early identification, early intervention, screening. So secondary, if we find that there's lead in the paint, we need to make sure that paint is removed and replace it with non-lead paint. So we early identify there's lead in the paint, and then we early intervene and remove that paint and replace it with non-lead paint. And what happens with tertiary? They're showing up with signs and symptoms of lead exposure. Right? So now we have to try and take steps to reduce the blood levels of lead because they already have it. Or they've already had the exposure. So nursing interventions to reduce environmental health risks can take many forms, but the key is education. Okay, by working with a variety of community members, nurses can explain the relationship between harmful environmental exposures and work towards risk reduction. Right, so here's an example from the book. A nurse can help clients know how important it is to purchase a carbon monoxide detector. Right, and they explain why carbon monoxide, what is the danger of high carbon monoxide levels. Okay, the other thing we're responsible for is risk communication. Okay, we counsel people all the time about the risks of pregnancy, communicable diseases, injuries, personal choices, smoking, alcohol, diet. But we also are responsible for communication of risks, other risks. Okay, we want to make sure, oops. We want to make sure that if there is an environmental risk, such as water contamination, I don't know, train derailment, chemical spill, right? We are going to be responsible, if we're in the community working as a public health nurse, to make sure that we know how to do how to risk communicate, providing the right information to the right people at the right time. Okay, so let's know those three. Okay, that risk communication involves three principles: right information, right? A good risk assessment is essential. And I mean, think about it. Think about in the community when there is, I don't know, an emergency, maybe an impending hurricane, tornado, right? Think of how a command center puts together communication, right? You need to give the right information to the right people at the right time. Okay. So please read this right here, this little box on risk communication, page 98. And this is kind of interesting to read through. Box 6.6, some environmental laws. There's nothing to memorize here, but really, you've probably heard of a lot of these. When we get to occupation, chapter 32, we are going to have to be able to define what the function is of OSHA. Okay, and we'll get to that in chapter 32, but I point this out in chapter 6 because this is a really good summary. You are going to have to be able to define the function of OSHA. So I like this little summary here. Okay, so that's on page 99. Okay, and OSHA is basically Occupational Safety and Health Act. It's to ensure workers are safe in their workspace. All right, free of hazards, free of accidents. So anyway, I like this definition, but we'll see that in a different way in chapter 32. Okay. Advocacy, you always want to read about advocacy because that's what we are as nurses, right? We are going to be advocates for the community, right? People come to nurses, right? 3 million nurses in the United States should be a strong voice for change. As informed citizens, nurses work to protect the environmental health of clients, families, and communities. We're seen as trusted sources of information. We're seen as reliable sources for environmental health information. Okay, So we can serve as resources for state and federal legislators and their staffs. And some of the other things we can do is write letters, encourage people to write letters to their local leaders if environmental issues are coming up and we want to have a voice. Okay. And let's see, we went through that. What are the roles for nurses? That is in the last, that's the last slide of our PowerPoint, so you can read through that. Okay. So that's our environmental health. Now, the one thing that I want you guys to go through on your own, because I don't want to take up all the time to do this, is I have done all the case studies. Okay, I had to send you them separately this week, right? But I want you to review these 3 case studies because when we look at developing the exam, we also look at the case studies and we look at the rationales. Okay, so for example, these 3 rationales in chapter 6 are excellent. Right? This one, well, let's go through number 1. We just talked about it. Okay, as nurses who are some of the most trusted sources in health information to the public, it's our responsibility to know about environmental health risks. This goes through the 10 principles that comprise the nurse's responsibility for environmental health. Okay. Read through that. This is a summary of the whole chapter right here. These 10 principles. This is a review of the whole chapter right here. The rationale in number 1. Okay. And then the rationale number 2 goes through the environmental sciences and gives you a definition of all of those, which we need to know. Okay, and then rationale number 3 is the ways in which the community nurse assesses the environmental risks. So, you know, I'm not going to go through them if you guys haven't reviewed them either, but I would highly suggest that you guys go and review these 3 case studies as well. Okay, I sent them all to you, 6, 9, and 32. Okay, questions on chapter 6? Okay, let's do epidemiology. Okay, this can be a really wordy chapter. Okay, I'm going to try and do the basics for you. All right, our objectives: define epidemiology. Right, describe essential elements of epidemiology. We'll get to that. Discuss our steps in the epidemiological process. Okay. We need to be able to differentiate between descriptive and analytic epidemiology. And then how do we use epidemiology in public health? Okay. So epidemiology makes contributions in understanding health and disease. I'm trying to be as basic as I can here because it can get really boring and wordy. Right? It also health promotion and disease prevention measures. A detection and sorry about the dog. You should stop in a second. The detection and characterizations of emerging infectious agents, that's epidemiology. Okay, the evaluation of health services and policies, and the practice of nursing and public health. All right, so slide 4 goes through descriptive and analytic epidemiology. Okay, we need to know the difference. It's really simple. Okay, analytic, or let's start with descriptive. Okay. Descriptive is describing the disease. What is it? Right? What is it? Who is affected? Where are they affected? When did it happen? So it's the what, where, who, when. Description of it. Okay. Where analytic is you're trying to analyze. How did it occur? Why were some people affected more than others? Okay. So you're analyzing. So it's the first one, descriptive, is the who, what, where, when. And your analytic is how did it happen? And that's more in the book as well. All right. We don't need to go through the history. How nurses use epidemiology. Right. We look at the health and the disease causation, right? And how both prevent and treat illness. That's just really, really wordy. I don't want you to get confused. All right. So think about epidemiology as surveilling, monitoring disease trends, right? So for example, me in school nursing, we monitor COVID trends. We monitor pertussis. In preschools, we monitor chickenpox. Right? In workplaces, in prisons, you may monitor TB. In workplaces, you may, I don't know, hepatitis. I don't know, whatever potential disease it is. Right? So when we look at epidemiology, how do these affect, how do we surveil disease? How do I surveil pertussis in an elementary school? Working with the health department.
You could look at the data and see how many kids miss school from that.
Exactly. Right. And then to take that a step further, our kids, what about the kids who aren't immunized for pertussis? Our protocol is those are the first families we call. Right. We have an outbreak of pertussis. Your child isn't vaccinated. We highly encourage you to keep them home until this has passed. COVID. That's all we've been doing for 2 years. Right? How do we surveil COVID? So epidemiology, believe it or not, epidemiology is used, and sometimes you don't even realize you're using it. Does that make sense? It's common, especially in community and public health. And here's some concepts of epidemiology, which again, it's just a lot of words, a lot of information, and I'll show you this in the book. Okay, we're going to learn about the epidemiological triangle. We're going to need to know that for the exam. Okay, and along with the epidemiological triangle is the web of causality. So big words, simple to understand. Okay, epidemiological triangle is the agent. We'll go through this in the book. The agent, which is the bacteria, the virus, COVID. The host is us. There has to be a live something to infect by an agent. And then the environment, it's up in the air. What's going on in the environment that, let's take COVID, for example. It may be the risk of transmission for an elementary school may be different than a nursing home. Depends on what factors are going on in the environment. And then this web of causality, just to be simple, is, how can I explain this simply? The agent host, there must be an agent to infect a host. And how that looks determines what's going on in the environment. Are people healthy and may get less sick? Are people immunocompromised that may get more sick? This web that we call it is a representation of all the different things that can happen between these three. Does that make sense? I'm trying to explain it in simple terms. Does that make sense? So it's a big web. Okay, so think of how many formulas can come out of the different factors in the agent, the host, and the environment. Is it a major agent? Is it a, is a light flu? Is it a common flu? Or is it a more complicated flu? Is the host healthy? Is the host not healthy? Is the environment conducive to getting more sick or less sick? Okay. Okay, and then more basic concepts in epidemiology. It gives you some examples of what primary, secondary, and tertiary interventions are with regards to epidemiology. So for example, why are immunizations primary? What are they doing? Hopefully doing
Prevention.
prevention.
Like something that's already there. Yeah, they're preventing something from happening, so
Right.
it doesn't turn into the tertiary.
Correct. Secondary is our screenings. And then why is tertiary listed as physical and occupational therapy? Maybe somebody has had a stroke, right? And they're coming home and they still need physical and occupational therapy. This, if you want a good read through of a secondary prevention, 11 and 12. Okay, slides 11 and 12 have an excellent summary of secondary. Okay. Key component of many secondary prevention, a key component of many secondary prevention intervention, testing groups of individuals who are at risk, right? Screening, effective screening programs, reliability, validity. Okay, we need to know the difference between reliability and validity. Here it is right here. Number 12. Okay, so we know the difference. We need to know the difference. Reliability, precision of the measurement, consistency, repeatability. So something is reliable. Is it valid? Is the measurement really what we think it is, and how exactly? Okay, so let's know the difference between reliability and validity. Okay, these two are a good 14 and 15 are good slides on descriptive and analytic. Okay. Who is affected? Where did it happen? When did it happen? That's all you need. You don't need to know all of the little bullets. You need to know descriptive. Who, person, place, where did it happen? What was the time frame? Analytic. How did it happen? Okay, and we need to know these. We need to know the difference between what is a cohort study? What is a case control study? What's a cross-sectional study? Okay, I'll show you that in the book. That's slide 15. And then you can read through slide 18 if you'd like. It's what you might be doing. Examples of nursing positions that use epidemiology. Did you know that school nurses use epidemiology? Yes, I use it all the time. Communicable disease nurses, environmental risk communicators, hospital infection control nurses. And this is important, this last bullet. All your nursing documentation on patient charts and records is important, right? It may have to be used as a source of data to gather information for an epidemiological study. You know, what if there's a hospital-based infection? What if there's been an outbreak of infection in the OR? Or an outbreak of infection, maybe a MRSA on a surgical floor? You need to be able to go back and do your you need to be able to go back and do your research, which involves epidemiology. Make sense? Okay, so real quick, our chapter 9 starts on page 147. Okay, we just went through the outline here. And again, if you just click on it, if I asked you to know the difference between reliability and validity, you just click on it. It takes us right to it. Okay. Oops, sorry. Here's it, you know, you're going to be given a scenario, and it's going to ask you what would be the best study for this scenario, a cohort, perspective, and there's a box in the chapter that gives you that, but you can click on these. Okay. Here's your epidemiological triangle, which we'll go through, but I'm just showing you in the outline, you can actually click on the things we've highlighted in the PowerPoint. Here's your objectives. I've highlighted a few key terms. Okay. Okay, so first off the bat comes Healthy People 2020, page 148. And it's geared towards epidemiology. So they have 4 examples of epidemiologic objectives for Healthy People 2020. So if you get a Healthy People 2020 question, it may be, please identify which of the following is a Healthy People 2020 objective for epidemiology. Okay. So know those, please. There's only 4 of them in that chapter. How do nurses use epidemiology? Right? Nurses play a key role in the community's interdisciplinary team, looking at health, disease causation, and how to both prevent and treat illness. This is an excellent summary right here of this whole chapter. Okay, page 150. Okay, let's read it. Nurses play a key role in the community's interdisciplinary team looking at health, disease causation, and how to prevent and treat illness. Nurses use epidemiology in the community to examine factors that affect the individual, family, and a population group, because it's more difficult to control these factors in a community than a hospital, right? It's really difficult to control the environment, including the water, the food, the air, versus being in a hospital, right? In the community, you're dealing with possibly contaminated water, contaminated food, air quality, disposal of garbage, insects and animals that carry infectious diseases, quality of paint used. So many more environmental risks associated with community residents are often exposed to many factors affecting their health. I don't know if you guys are reading through any of these case studies that I'm providing you the answers to. When I send out my Sunday power announcement with PowerPoints and case studies, I'm also sending you the one-page case study, which is right here. These are all the answers to these case studies in these chapters. And again, it's just more rationales, more case studies to look through. So when you get that single page where it says student case study, that's the activity in the book right here. Okay. We need to know the definitions of these: rates, proportions, and risks, right? Basic concepts of epidemiology. How do we measure morbidity and mortality? We do that by rates, proportions, and risks. Okay, so risk. What's risk? Simply, risk refers to the probability that an event's going to occur within a specified time. Right? That's risk. Rate. What's the rate? Quantifies the rate of development of new cases. What an incidence rate quantifies the rate of development of new cases in a population. Okay, so what's the rate in which it's developing?
Like how fast
Yeah.
it.
What's the
Okay.
rate? Yep, exactly. And then the proportion indicates the proportion of the population at risk that experiences the event.
Is that like 1 in every 3 people?
Exactly.
Like, okay.
Exactly. What are the proportion? I'll show you this box that I want you to know down here, which goes through all of that. So it's your formulas. You know, you hear the death rate is 75 per 100,000, or the infant mortality rate is 4.3 per 100,000. Okay, here's how they're calculated. Right here. This is what I need you to know. Table 9.2. And I've highlighted a few that I want you to know. It's simple. I mean, crude mortality is what we call the death rate. How do you calculate a death rate? Pretty simple. Number of deaths from any cause divided by your population. So for example, you have 2.4 million deaths in a total population of 275 million. Broken down, it's 873 deaths per 100,000. Okay, cause specific rate, number of deaths from specific cause divided by the population. For example, here you have 97,000 accidental deaths. So it's a cause specific. It could be cancer deaths, accidental deaths, overdose deaths, whatever the cause specific is, right? So you have, here we're using accidental deaths. 97,000 divided by 275 million is 35 per 100,000. Okay, so you need to be able to calculate if just know a couple of these. I want you to know the crude mortality rate, death rate. And don't get tripped up on all these fancy words. This is number of deaths per population. age. Specific number of deaths, that would be number of deaths among persons given an age group versus the estimated population. And down here at the bottom is the infant neonatal mortality rate, infant mortality rate, number of deaths of babies under a year. Right, so if there were 28,000 infant deaths divided by how many live births there were. So there was 0.0069 or 6.9 per thousand live births. Make sense? I don't want to make this complicated. Okay. Cause specific, number of deaths from something divided by the population. Okay. So I'd like you to know crude mortality rate. I'd like you to know age specific rate. I'd like you to know cause specific rate and infant mortality ratio. Okay, those are the four I'd like you to know. You're probably going to have a scenario. You're given a scenario and you're going to be asked which would be the best rate, which would be the best way to calculate it. Okay, simple. Okay. And if you want to understand these a little bit more, right down here, right below this table, you can read through it. Really interesting information, actually. The cause, here's an example. The cause-specific mortality rate is an estimate of the risk of death from something, some specific disease in population. Simple. Okay, it's the number of deaths from a specific cause divided by the total population, multiplied by 100,000. So I don't want you to get caught up in all the words, right? Okay, let's talk about the epidemiological triangle: agent, host, and environment. Okay, epidemiologists understand that disease results from complex relationships among agents, casual agents, susceptible people, and environmental factors. Okay, these are the three elements, agent, host, environment, that are made up of the triangle. Right? Changes in one of these elements of the triangle can influence the occurrence of disease by increasing or decreasing the person's risk. And that's what we said. Is the agent mild or is the agent severe? You know, is it a mild case of the flu or is it a severe influenza? Is it a significant bacteria? Is it a MRSA? Right? So changes to one can impact everything. And that's what we call the web. There's so many potential scenarios. Okay, so agent, host, and environment. So we're going to go to this box 9.1 so we can see it. Examples of agent, host, and environment. Okay, so agent, what's your infectious agent? Is it bacteria, virus, fungi? Are they chemical agents, physical agents? Right? Is it radiation? Is this extreme heat, extreme cold? Is it pesticides? Exposure to toxic chemicals, heavy metals? Ooh, who's the host? Let's say it's me. What's my genetic susceptibility? Do I have any health issues that may cause me to get sicker? Or am I a healthy person that may have a stronger immune system and can fight off things? Am I old? Am I young? Is it male, female? Are females more affected than males with a particular exposure? Who knows? What about my immune status? Is it good? Is it bad? Is it compromised? That's going to affect how we face the agent, or how the agent affects us, right? And then lifestyle factors, diet, exercise. Obese, if we're obese, are we more at risk, more susceptible to getting sicker to whatever agent we're talking about? And then the environment, what's going on in the environment? What kind of climate are you in? I don't know, if you're up in Antarctica and it's freezing, are you going to be more at risk for certain things? Or if you're in extreme heat, right? What about if you're in crowded places? Socioeconomic factors, education, resources, access to care, poverty, working conditions. I don't know, are you working in an environment that the level of stress is off the charts, the noise is off the charts, you're working in a factory? Right? So can you see how these three can create a gazillion scenarios? Right? I don't mean a gazillion, but you know what I mean. A lot of scenarios. And that's what we call the web. Right? The web simply recognizes all the complex interrelationships between these three. Okay? Did I do that in a simple way? I need to make this chapter simple. Okay? So, levels of preventative interventions. This chapter gives a nice summary of all three. Has a box, but it also gives more details. So I want you to read through that. Starts on page 156. And of course, this information is presented from an epidemiological standpoint because that's the topic we're on. Okay, but it gives you an excellent summary of each level. So primary, secondary, and tertiary. Okay, so take a look at those just for additional information. Here's a nice little summary of the difference between valid and reliable. Validity, reliability. Okay, so numbers 1 and 2 in box 9.2. And then to read further, if this doesn't make sense, 1 and 2, go right below it and read about it. Reliability and validity. Okay. Guys hanging with me?
Yeah.
Yes, ma'am.
Yes.
Trying to help. Okay. Okay, here is another section of this chapter, starts on 160. If you want to read more about descriptive and analytical epidemiology. Okay, it gives it more specific. So for descriptive, who is the person? Place, where did it happen? Time, when did it happen? If you want, if you don't understand it. And then analytic is the how and the why. Okay. So simply, descriptive epidemiology deals with to me, this is too wordy, deals with the distribution of health outcomes. Okay, I wouldn't even, go here. Let's go to box 9.3. There are study designs that we can use that are used to do epidemiological studies. Okay. There's 5 of them. I just need you to know a simple definition of each. Okay, So for example, the ecologic, this is a quick, easy, inexpensive first study. It's all you need to know about it. And actually the ecologic is the most popular for nurses. If you are a public health nurse and you are doing epidemiological studies and research, this is what you typically like to use, the ecologic model or study design. Okay, cross-sectional, also called correlational. And then you have your retrospective or case control. Case control. Right, less expensive than a cohort, but smaller sample required. It's quicker than a cohort, no follow-up. I don't need you to know this whole box, but I need you to know just a couple of characteristics about each study design. Okay. So just 1 or 2 lines about each one, but we do need to know that. You're going to have a scenario and asked which study design would be best used. So don't worry about everything. Don't worry about disadvantages, but advantages, 1 or 2 highlights. Okay. And then if you want to read about them and get some additional details, if you're not understanding it from up here, right here. Okay. Like for a cohort, it says it comes the closest to the idea of a natural experiment. That's all you need to know. Okay. All right. Retrospective. Okay. Think cross-sectional. Okay. And here's your ecologic, the popular one. Okay. We don't need to know about clinical trials. I think, oh, levels of prevention right here. So related to, this is epidemiology, they've chosen cardiovascular disease, right? So what's a primary prevention for cardiovascular disease? Maybe discuss a low-fat diet and the need for regular physical exercise. Education, prevention. Secondary, implement blood pressure and cholesterol screening. Maybe give a treadmill stress test, all screening. Right? Trying to early identify who's at risk for cardiovascular disease. And then tertiary is, we have to make the assumption they've had some kind of cardiac event. Right? So tertiary is possibly provide cardiac rehab, medication, and surgery. Okay. And here's the other part of what I send you every week is practice application. It says answers to practice application. And here it is. It's in every chapter. So if you want to go through and do this activity, I've provided you the answers. Okay. So that is chapter 9. Anybody have any questions about that? But chapter 9, epidemiology chapter is kind of a hard chapter. I really try and, oh, my battery's running low. It is. Hang on. Let's see. One second. Ooh, sorry about that. Okay. All right, last chapter. Pardon me. Last chapter I want to cover. Oh, before I forget, I need to see, just real quick, I need to see who came in here. Kirsten, did you make it in here? Okay. And then Karina, did you make it in? To Kirsten and Karina. Okay, cool. Thanks. Sorry about that. All right, let's get to occupational health. Okay, so this is occupational health is the last last of the specific roles that we're going to cover for community nursing. So we've done school nursing, we've done home health nursing, we've done hospice nursing, we've done faith community nursing, and now we do occupational health nursing or occupational health. Okay, chapter 32. So you guys can read through your objectives, right? But here, I want you to be mindful down here where it says describe the functions of OSHA. And there's another one, it's called NEOSH, National Institute for Occupational Safety. We have to determine the function of both of those. Okay, so what do we think when we think occupational health? Where is that? What area is that looking at?
Nurse that
Occupation.
work in the like that focuses on the hazards in the workplace.
Yeah, exactly. It's workplace. Yep. Occupational health is workplace. So introduction, no work is completely risk-free, right? And all healthcare professionals should have some basic knowledge about workforce populations, hazards. How do you control the hazards and how do you improve health? Occupational health nurses have performed critical roles in planning and delivering worksite health and safety services. Okay, so as with our other community health nurse roles, occupational nursing has its own scope of practice as well. Just like the faith community nurse had their own scope of practice, just like the hospice nurse had their own scope of practice, the school nurse. Okay, so slide 4 is about what is the scope of an occupational health nurse, right? They focus on preventative health care, health promotion, health restoration, trying to prevent adverse health effects from occupational environmental hazards. You know, what if you're working what if you're an occupational nurse in a mining company? What about a big power plant, nuclear power plant or power plant? What about a car factory? I'm just thinking of all the big occupational places that you could be working that have potential environmental hazards. Right? Typically, in the past, occupational nursing has been focused in traditional settings, such as, say, manufacturing, industry, healthcare, even healthcare facilities. What about big construction sites and big government settings? Right? Those are big places. That's kind of a big job for that occupational nurse. And here's he or she's scope of practice, potentially, right? Workplace assessment, surveillance. Needs to know what your workers are doing. What are they exposed to? Do they have the right safety equipment? You may be doing primary care in a clinic if there is an accident. Case management, consulting, counseling, health promotion, protection, research, orientation. And I just mentioned this academic education because it's, is generally at the graduate level. However, many nurses with associate degrees in nursing or bachelor's also work in occupational health. Has anybody ever worked in an occupational health setting in this group? Really important stuff, really important work. You're responsible for keeping your workers healthy, free from injury. And how do you do that? Educating them on their risks. Right? We know that workplace and the workforce is rapidly changing. Right? We know that there are dramatic shifts in the type of jobs people are doing. Right? We know that there are influence of work on health is shown by statistics on illnesses, injuries, deaths associated with employment. Okay, and here we can even apply the epidemiological triangle to occupational health. Right? This is a good summary of it right here. Host, any susceptible human being. Assume that all employed individuals are at risk of being exposed to occupational hazards. That's the host. So think of somebody in a manufacturing setting, for example. Okay, let's use that for an example. So the agent in that setting could be maybe a biological exposure, chemical, environmental, mechanical, physical, or psychosocial. We'll do that in the chapter, but these are the 5 areas that we need to know that are potential exposures in occupational health: biological, chemical, environmental, mechanical. I'm sorry, 6. Physical and psychosocial. They're in the book. I'll show you where that is. And then your environment. How does your environment affect your agent and your host? Well, the environment in occupational health includes all external conditions that influence the interaction. I mean, think of all the different factors internally, externally in the environment that can affect something in a big mechanical plant or a big construction site or a big mining company. Okay, so I want you to read slide 10. Organization. How do they get together and work together? What does an occupational health and safety team look like? Okay, they focus on work-related health, safety problems. Who's part of that team? It might be the occupational health nurse, the occupational physician, the industrial hygienist, the safety professional. Okay, some of the things that you might be doing as a nurse in occupational health is doing a worker assessment. Right? Are there certain people that are getting too old that through your worker assessment, you realize that they can't be doing the heavy lifting anymore? Doing a health history. You know, they've had 3 injuries in the last year. Okay, probably time to take from lifting. Probably time to move them into another place. All right. Has the occupational nurse done a workplace walkthrough? Does she know what risks are out there? Does she observe people wearing the correct safety equipment? Using the equipment properly? Okay, Healthy People 2020 actually comes up in the chapter outline. So we need to know these 2 things. This is what their guidelines are for occupational health. Healthy People 2020, there's 2 of them. Okay, here is your 2. Need you to know these 2. OSHA, and this is called NEOSH, number 13, slide 13. Okay, big picture. NEOSH is the big picture. Okay, they are responsible for investigating workplace illnesses, accidents, and hazards. So they're the investigative body. The OSHA is hands-on. Okay, they're the worker bees. They're charged with improving worker health and safety. They're the ones who try and establish the standards for your particular industry and educating workers. So they're kind of on the ground. Okay, OSHA is, have you ever worked in a place? I have. Have you ever worked in a place that's going to have a OSHA inspection? Everybody's running around trying to make sure their MSDS sheets are, anybody know what an MSDS sheet is for occupational health? That should be in your workplaces. What do they tell you?
Oh, wait, is that the thing that shows the like what to do with the chemicals?
Yep, where they're all located. Yep. Right. Right. Those are the kinds of things that OSHA looks for. Right. Establishing standards and regulations, educating workers. Okay. And then the last thing is you have to have a disaster plan, because in the workplace, and we've seen it over and over again, potential disasters or actual disasters. Effective disaster plans are designed by those with knowledge of the work processors and materials, workers, workplace. Meaning you have to have the right people involved in preparing these disaster plans, the hands-on people, the people who know, that are professionals in those areas, right? You have to have specific steps that are put in place, details put in place by whatever your team is, your crisis management team, your disaster planning team, whatever they're called, in the event of a disaster. And that is standard procedure now, that you have to have a disaster plan. I participated many times in disaster management planning for our schools. And you may be asked to do that in the workforce. Okay. Or out in the workplace where you're working. Okay. Just want to go to show you a few things in the book here. Here's your Healthy People 2020. Here's your host agent environment. Okay. Let's go through a few things here. We're in the home stretch, guys. Hang tight. Okay. We need to know about the characteristics in the workforce, page 563. And what we need to know is here, what I've highlighted. Okay, so let's read through this. The demographic, we're on page 563. The demographic trends in the US workforce indicate a changing population aggregate that has implications for prevention services targeted to that group. Okay, so we know that major changes in the working population are reflected by the increasing numbers of women and older individuals, and even those with chronic illnesses who are part of the workforce. Okay, and because of the changes in the economy and the living longer, right? We now have to have legislation and society's acceptance of working women. Right? And let's see, the proportion of the employed population in these groups is going to continue to grow. Right? Women, older individuals, and those with chronic diseases. That's going to continue to grow in the workforce. So we have to be prepared to deal with that. Okay. Here's the other thing we need to know about occupational health is the characteristic, right? So the first was the demographic characteristics of the workforce, right? So women, older individuals, and chronic illness. Those are the three areas of the workforce, the populations within the workforce that are increasing. Second, we need to look at is the characteristics of the work. Okay, so we know that over time, there's been dramatic shift in the types of jobs that are held by workers. Okay, typically in the past, we have looked at the service industry, professional, technical positions, clerical work. Okay, that's been the history of. However, we need to know this. The change in the nature of work has been accompanied by many new occupational hazards. Okay, so here you might get a question that says, select all of the newer occupational hazards that have emerged. Okay, 1, 2, 3, 4, 6 of them. Okay, complex chemicals, nanotechnology, non-ergonomic workstation designs, and then these last are pretty significant: job stress, burnout, exhaustion. Okay, so we need to know this, characteristics of the workforce, which is the 3 different groups of increasing population. And then what kind of new hazards are we identifying? Okay, and then it goes through each of them. We don't need to, you guys know about the epidemiological model. Okay, here's what we need to know. We need to know, here's the third thing we need to know from this chapter are, what are the categories of work-related hazards? I just need you to know the categories. Okay, and a brief description of each. Okay, so there is 5 of them: biological, chemical, environmental, physical, and psychosocial. And I want you to read each one of them. For example, what's a physical hazard? In the workplace, think in the workplace. Agents within the work environment: radiation, electricity, extreme temperatures, noise. Okay, what are psychosocial hazards? Stress, emotional strain, interpersonal problems. Okay, so we need to know these. What are the 5 working related hazards? They're broken into 5 categories. Okay. This is interesting. No need to memorize this, but interesting. Table 32.1. It gives all these selected job categories. Let's say glass workers. What are they typically exposed to? And what are potential work-related diseases? So I would have not known this, but let's go to glass workers. Well, their exposures may be to heat, solvents, metal powders. Potential problems, cataracts. So this is just, jackhammer operators. What are they exposed to? Vibration. Raynaud's phenomenon, potentially. So anyway, I thought that's interesting. And then it goes through the 5 different categories: biological, chemical, environmental, physical, temperature extremes, vibration, noise, radiation, and psychosocial. So it goes through those 5. Okay. Here, this is interesting. Scope of services provided through occupational health. So these are all things you might be involved in if you are the occupational health nurse or part of the occupational health team, safety team. Lots of things you potentially are involved in. Levels of prevention, page 570. Take a look at this related to occupational health. Primary, provide education. Secondary, screening for hearing loss resulting from high noise levels in the plant. Tertiary, work with employees with chronic diabetes. They already have diabetes, right? Maybe do a clinic, do an educational session to ensure appropriate medication use, blood sugar monitoring to avoid lost work days. Those just examples. Okay. I think that is it. Oh, Healthy People 2020. How could we forget? Okay, so here's your Healthy People 2020 objectives for occupational health. Okay, so just put those on a card. And then here is your OSHA and NEOSH. Okay, functions of these federal agencies. I like back in the other chapter, the little simple definition of each. But enforce occupational health standards, educate employers. NEOSH, conduct research and review research findings. Okay, to me, this is much more wordy than what we did back in chapter 6. And I showed you back in chapter 6 where I like the definitions back there. And then you can read through some disaster management. But we kind of already covered that, right? The goal of a disaster plan is to prevent or minimize the death, injuries, and deaths of workers and residents. Okay. Disaster plan requires the cooperation of different personnel within the company and the community. I'm sure every place that you work at, all of you in the workplace, have a disaster plan. And you're probably asked to know about it, know where it is, what your role is, what your job is. You may be even asked to participate in updating it. Okay, you may be asked to participate on a disaster planning team or a safety planning team. I know as school nurses, we're always on the disaster planning team because we have kids with health issues. And what's the plan? Okay. Okay. Okay, that's chapter 32. Okay, so there's our 3 chapters. Study guide. I'm gonna let's do this. Let's go to the attestation and do the attestation real quick. And then I'll cover 15-20 minutes of the study guide and show you guys how I think. I know it's over, but want to stay on, I'm happy to do that. Is that okay? So let's do the attestation. Everybody go to their attestation. And somebody read the first question to me.
What are the 3 elements of the epidemiological triangle?
Say, what are they?
This is agent, host, and environment.
Correct. Okay. And what's the second one? We just covered it. It's from the occupational, it's from chapter 32.
To chemical, biological, and physical are a couple of them.
Can somebody pull up the page that was on? We just went through it in chapter 32. What's the question?
Within occupational health and the changes in the nature of the work, there have been many new occupational hazards identified. Please name 3.
Okay. What are they?
Job stress, burnout, Exhaustion.
Yep. And what are the three above that? Nanotechnology was one. Non-ergonomic workspace was another. I think there were 7 of them. You just need to name a couple, but do you guys know what I'm talking about? You know where to go find that, right? That was one of the areas I highlighted in the chapter of the new kind of occupational health risks emerging, right? Oh, I have 2 chats. Why do I never check those? Oh, okay. Okay. Can I jump to the study guide? I hope you guys can come to a review. I really do. So here's how I told my group yesterday, here's how I think you should tackle it. Okay, you can read through the front page is the same as the last one. I want to go to page 5. Let me show you how we broke it down. This page 2 and page 3, okay, goes by the weeks. Okay, so this is the first chapter we covered in week 3, rural health and migrant health. Okay, so the first section of your study guide is chapter 22. Okay. The second section of your study guide is vulnerable populations, which was chapter 23. Okay, so page 3. And then the last part, or the third part of your study guide, is alcohol, tobacco, and other drugs. That was chapter 24. So that covers week 3. Okay. Top of page 4 starts week 4. And this is all lumped into one category, one heading, right? So week 4, we covered the faith community nurse, the home health nurse, and the hospice nurse. Then if you go down to page 5 is what we've just done today. So I'm going to start there. This is how I think you should use this study guide. Between last week and this week, everything on here, the study guide, we should have covered. Not word for word, but at least the topic. So what I like to do, and what I'll do in my review this upcoming weekend, is go through each of these bullets, make sure we understand the information in these bullets, and think of what kind of a question might you get within these bullets. So for example, let's just go through today's, since it's all fresh in our mind. Know the definition of epidemiology, how it applies to infectious epidemics and other health-related events. Know the definition of analytic epidemiology and examples. So what question might you get from that? Well, first of all, it's asking you, know the definition of epidemiology and know the definition of analytic epidemiology. Straightforward. Know those 2 definitions. So what kind of question might you get? Maybe a definition question?
Yeah.
That's what it's asking you. Okay. Let's go to the next one. The case fatality rate is the proportion of persons diagnosed with a particular disorder who die within a specified period. The case fatality rate is considered an estimate of the risk of death within that period for a person who is newly diagnosed with a disease. Right? Often people diagnosed with a disease want to know the probability of surviving. The case fatality rate provides that information. What kind of question might you get?
The mortality rate divided by the
Exactly.
population, is that one?
Exactly. I mean, exactly. That's great. Let's read the next one. Individuals, well, let's go to the next one, or because I'm not going to go through everyone. You need to go through these on your own as well. The fourth one is healthy people. Review Healthy People 2020 objectives for environmental health. Provide examples of each, and it applies to environmental health nurses. What might you get? Maybe pick the best answer that identifies Healthy People 2020 objectives with regards to environmental health. Right? I don't know. I'm just throwing that out there. I'm trying to kind of dialogue. And so anyway, this is how I like to go through the review. What is the role of the occupational health nurse? What would examples of primary strategies to reduce environmental health risks? We just went through that today. Review the principles of the epidemiological triangle. Give an example of each one. And here, why do community health nurses need to know about epidemiology? Look at box 9.1. Incidence prevalence. What are the definitions of each of them? And here's that ecologic, cross-sectional, retrospective cohort study designs. Just know the simple definition of each. And then we just did occupational health nursing. What's the role of the occupational health nurse? What question might you get there? Select, maybe, I don't know, select all that apply for what the role of the occupational health nurse is. Here, review the hazards that an occupational nurse would evaluate. What about all those new hazards we just talked about? Right? We just had our second attestation question. Review levels of prevention in occupational health. Right? Look at Healthy People 2020. Couldn't be more specific than that. And then know the functions of OSHA. Okay, we just went through all of this in the last couple hours. Okay. And then I want you to just take that back and go through last week as well. You know, last week, what is the difference? Review the definitions and provide examples of congregational based and institutional based nursing. There shouldn't be anything in these first couple of pages that we haven't covered. Okay, and if there is something on here that you're unfamiliar with, you're going to need to go research it. You're going to have to go back to the book and find that section, or go back to your notes. Does that make sense? That's how I think that study guide is helpful. Okay. Everything on the study guide should have, at least the topic should have been presented to you by me in the last couple of weeks. Maybe not word for word, or, you know, but the concept, the topic has been presented. So now you need to go back and make sure you understand it. Right? And think of what might be asked. The definition question, could it be a select all that apply? Could it be a priority question? You know, what is the greatest? What is the least? What is the most? Okay. Does that help? So give me your assess. I know we went a little bit over. I apologize. Anybody have any questions? Is this helpful?
Yes, thank you.
To think about the study guide in this way? You know, especially if we just go to that page 5 of the study guide and cover the last 2 hours. Should be pretty fresh in your mind. Make some notes. And if you need to go back and reread, go to the book. Go to the outline at the top of each chapter of the book and pull up that section. Just click on the section you want to go to and it will take you right to it. So you don't have to go searching through the whole chapter. Okay. Questions? Is this all I'm left with is you guys? A lot of people left.
Yeah.
I'm going to stop the recording anyway.